As rural health departments continue to distribute vaccines, many are running into issues beyond just hesitancy. Brock Turner has more on the uphill battle some health departments are facing.
For Sherry Lewis, this past year has been beyond trying. For months, she and other local health officials have faced uphill battles with limited budgets to approve local events, contact trace, and help schools stay open. While vaccines offer hope, it's also another task that already taxed local health officials are managing. Data from the Kaiser Family Foundation reveals rural residents are more likely to view vaccinations as a personal choice and are less likely to be worried about contracting COVID-19. To make matters worse, public health resources and staffs tend to be limited in these areas.
We started off slow for the first 2 weeks. January 11th, we were vaccinating every other day with one vaccinator.
But Lewis and her team would quickly ramp up their local efforts, thanks in large part to a group of 20 volunteers.
Without our volunteer staff in Greene County, we would be vaccinating 100 people a week. And we're vaccinating 500. So, that's more than doubled.
Among those volunteers is retired nurse Peggy Wolf. Wolf has volunteered after other disasters, but never this close to home. She says a call from the state health commissioner, Dr. Christina Box, provided the incentive she needed to help her local health department.
I decided to step forward after Dr. Box was sending out encouragement to be a Hoosier hero. And so I said, well, it's time. And I've done sort of things like this before, but I said that's enough. And then I just started volunteering doing contact tracing with the health department. And then we went from there to sort of form a volunteer army for this vaccine clinic. So
while Wolf insists she's not going anywhere, other volunteers might not be so giving of their time. Many rural county health departments lack the staffs and resources to fully fund their own clinics. Before these volunteers stepped up, Greene County could only dedicate one staff member to its vaccine clinic. Similar challenges are felt across the state. That's according to Carrie Thompson, the executive director at Indiana University Center for Rural Engagement. She says the center and other thought leaders are doing their best, but resources targeted for rural communities are rare.
We're all in this alone, almost. And if we could develop some best practices and disseminate them quickly, in a trusted manner and allow the people on the ground who are innovating well to share what's working in their communities, then I think that we could have gotten a faster response, and it's something that we should learn from.
Thompson and local health officials agree more funding from the state could unlock new opportunities to reach more residents.
Federal and state aid are going to be made available. It will be put to great use. And at the center, we always, we are firm believers that communities know what they need best.
Late last year, Indiana sent funds to local health departments in hopes of bolstering staffing. Up to $40,320 went to Indiana's smallest counties, but in many, resources are still scarce. Box insisted earlier this week additional funding and members from the Indiana National Guard are available for vaccine administration. Lewis is searching for funding from anywhere to compensate her volunteers.
They're coming, they're spending 20 hours or more in the clinic at, completely free, like totally volunteering. So I would like to be in a position to at least, compensate them for gas, for lunch, or, some type of stipend.
While some health departments have been able to staff clinics, several local health officials admitted they could be vaccinating more people if more funding was readily available. In the meantime, Wolf is going to continue volunteering at the pop-up vaccine clinic in Greene County. She's also taken up lobbying her neighbor.
I have a neighbor who is on the county council, and I've solicited him to say you need to get them more money so we can help out with either gas or just even perks. We have a wonderful team here that said it's almost like it's a homemakers club because everybody brings in food for us, and it's the volunteers that bring it in.
Lewis insists the volunteers have made a fundamental difference and given this community a shot in the arm. For Indiana Newsdesk, I'm Brock Turner.